Welcome to the YouTube channel of Dr. Akmal Makhdum. This is the third in our episodes about coronavirus and the psyche and the psychological elements behind this isolation, the different reactions to the virus. For those who are joining us for the first time, welcome, and for those who are back, welcome back. Now, Dr. Akmal Makhdum, after our last two episodes, we have had some questions from all over the world. Today, we're going to be focusing on the impact of the measurements that are being taken socially, politically, and legally. Michelle from Canada has some questions, and we're going to pose this to you because they have a far-reaching impact. Now, with this potential isolation that started, what is the impact on our own state of mind?
The impact of isolation is quite serious. Isolation can result in anxiety, depression, insomnia, and can cause serious perceptual and other experiences. In severe circumstances, it can cause hallucinations, and people can become paranoid, and they can go into a world of their own. So it is important to be isolated, but in a social sense. So the important thing is to keep in touch with family and relatives. Isolation doesn't really mean total isolation of the individual. It's not a quarantine of every aspect of life. What it means is that you try to reduce as much risk as possible. And that is taking the appropriate measure, social distancing, gloves, washing, masks, etc. And at the same time, constantly keeping in touch through either social media or through other communications, mobile link, video chats, and so on. So I feel that isolation is, I think, a new form of isolation may appear out of this experience, which we may call, socialized isolation. So it's a term that we can coin, that we should be looking at socialized isolation. And our socialized isolation means that we isolate ourselves from the virus, but not from human beings in terms of the measures that modern technology accords us.
As we've seen in UK with the shutting down of the pubs, people are now socializing through WhatsApp and Skype, etc. Yeah. That's a wonderful way of putting it. Thank you for that. Now, in the previous episodes, we've talked about how different nations, specifically the nations that we are experts in, Pakistan, for example, and England, they have had very different approaches. Now we've seen that Pakistan has gone on complete lockdown. The military has taken charge. And the West is, certain countries are doing it, but UK hasn't got to that point. What differences do you think this social isolation will be? What differences will happen in the West and in countries like Pakistan? Is there going to be a difference in reactions to them?
The thing is that I do not believe that complete lockdown is possible in Pakistan. In the province of Sindh, they have requested paramilitary help in implementing. It is possible that it is done in certain areas where there is easy access of the law enforcement agencies, but it is not going to be possible in those extremely congested areas where there isn't access and where there isn't ability of law enforcement to go in. So these are mini cities, mini populations within populations, and they are inaccessible to the outside world at the best of times in terms of their interconnections and so on. The houses are built in such a manner, the illegal settlements are built in such a manner that people mix up so publicly and commonly, and whereas around that community you can have a degree of isolation, but not within. So this is an idea. The other thing is that no country can bring about social isolation or lockdown unless people are fully on board. The military may be involved, but the military isn't going to be implementing draconian punishments on its own people. And they're not going to be, sort of arresting and shooting down people who break that. There will be some nominal or marginal, I would say, a punitive or a penalty measures, if there are any.
Well, okay, but in some in Scotland when they imposed this new rule, the police have been called in to enforce people who are being maybe a bit more stubborn.
I was talking more about Pakistan, not
So
in
yeah,
England.
so now let's bring about England.
Yeah, so the first thing is that we need to look at communities like Pakistan, where unless the whole population is fully on board, and we are talking of 220 million people, no government, no military can impose that degree of control over that population. And the thing is that we are talking of people being isolated in their homes. And what of those people who do not have any money? What of those people who do not have any medication? What of those people who are starving? And of course, the resources aren't available to do that. So this requires a great deal of education, a great deal of mass communication, a great deal of emergency-based communication mechanisms. And that is only possible through massive and immediate emergency communication messages.
Right.
Now, the important thing that I would like to say is that so far, as I said, nobody has told the people of Pakistan and the Pakistani population at large what it can do. There are only talking in symbolisms that it is a devastation, it is going to do X, Y, and Z. The important thing is that you need to be very clear. You need to say that we have, it can affect up to 80% of the population. If out of that 80%, if 60% are not at risk, 40% are, that means that 8 crore or 80 million people are at risk. And if 80 million are at risk, and out of that 20 million are affected, then that is 2 crore of people. And if 20 million are affected, 3% die, we are looking at, 600,000.
Okay.
Or that's a lot of people. Right. And if it's the elderly, and as we said, it is going to wipe out the productive and the knowledgeable class group of the whole country. So I would say that we need to have a clear description in visual terms, the audio-visual messages, scientific facts
that can be
need to
digested.
So people can understand and see with their own eyes. What we are currently seeing is very, very petty, low-level communication methodology. It is not going to work, and it is going to cause severe problems. On now, coming back to England.
Yeah.
England has a lot of expertise, like many other countries, of dealing with epidemics, foot and mouth and flus and other viruses, etc. And I feel that what they're trying to do is to generate the same methodology of looking at the graph of or the trajectory of the expansion of its spread, and at specific moments attack it in such a manner that it does not peak and that it gets depressed. So this is a calculated risk in which people in England, I believe, the policymakers are looking at it in a clear scientific manner that X amount of damage to the population is going to happen. So we must accept it, but we will, without devastating the whole community, the whole social construct, we will approach it in a gradual manner.
Right.
So, as I said, that this discussion is primarily about psyche and not about policy.
Yeah.
And it's a reaction to what people in power do. I do not want us to be delving into the areas of policy making.
No, exactly. So let's get back to the psychology behind it all. In UK, we are seeing people stockpiling. You know, it's actually a big issue here now. Supermarkets have changed their timing. Certain have to close, etc. I was reading today that France is not experiencing issues of empty shelves. Certain German countries are not. Cities and towns aren't. Countries which are, even Italy, they're not seeing this panic which we have been shown in the media within UK. Why are the UK, population? What's the psyche behind this? In a developed country where food is available, things are still able to run. There's more systems which are not broken, unlike certain developing countries. So, what is happening in the UK?
I would still say that there are certain items that people are focusing on. The underground is still working in the UK, buses are still running in the UK. And so I think there is a degree of relaxation about it as well. But of course, people are scared of one thing, basic, that will they go hungry? Will there come a time when there will be no food available? So there is that fear, but I think it's transient. I don't think that it is going to be a sustained impact. But at the same time, what we see is that in the morning, all the shelves are full. And it is...
There's queues outside.
There are queues outside, and the queues are organized. There are no fights. There is no violence. There are no robberies. There are no attacks on grocery stores. But yes, there is a fear now coming in that there is going to be a possibility that a long haul effort is required. There may be a guidance coming, hopefully, that may suggest that we may have to isolate ourselves for a number of weeks now.
Exactly. No, so that's absolutely fine about the policy. But like you said, let's get back to the psychology. Why in England do we fear going hungry? That is my point.
Okay.
Yeah.
It is like everywhere else, but I would say in a more civilized manner, the fear of all people is of going hungry.
Right.
There isn't any reassurance that has come so far from, because I'm talking of psychology here. Here, what you require is leadership once again. Now, if the leadership says, guys, don't attack food shelves, we have enough food stuff available for 2 years, 5 years. We are going to make sure that the dairy farms are running and shops are okay and so on and so forth. Now, if these are the assurances that are required, once you give those assurances in a welfare state, in a state where there is a high degree of knowledge and education, which is completely organized in the manner that every individual is registered with a set of authorities. If it is the local body and the National Health Service and the Inland Revenue, the local police, everybody knows who's, where is somebody's living and how many people to a single individual. So I would say that here in an organized society, the leadership should come out and say, do not fear, do not do X attacks on supermarkets.
Right. Okay. Because that was another article I was reading today. They're saying that this panic buying and the reaction is because of a failure from leadership and from the media. they're hand in hand, not fulfilling the role they're supposed to in such a crisis.
I would not say media so much. Why?
Really?
Yeah, I'll tell you why. Uh, Primarily, except for the BBC, media is commercial.
Right.
Ratings are important.
Exactly.
Sensation and bad news sells.
Exactly.
So that's what they're doing. They are actually selling their product. So for us to expect that, a special kind of animal inhabits the world of commercial media is our own delusion rather than. Whereas I would say that BBC, the government, which actually must control that particular message, is failing in educating people not to panic unless there is a need for panic.
Right.
Now, the thing is that is it that the government is quiet about it because they can't reassure people that there is enough food?
Right.
Is it that they are allowing this frenzy to carry on? So I really don't know what's going on up there.
Okay.
But what I see is that this particular psyche in England, if they can fight the Battle of Britain and they can tolerate the Blitz and the right messages and feel that Churchill was such a great leader, despite the fact that I don't agree with that entirely. But still, what I would say is,
Let's stick to the point.
yeah, let's stick to the point. But this is what I'm saying, that he captured the psyche of the nation at that
was
time,
one, yes.
and that was his leadership.
Absolutely.
And so this is the problem, that the person who idealizes Churchill and wrote a biography about him
Is unable to.
has not been able to bring about that leadership because we do not remember from our Prime Minister any speeches which are reminiscent of Winston.
Okay, so now I want to bring back another question that Michelle from Canada has posed, because in Canada it seems to be different. People are isolating. Anyone under 50 is tending to stay in. Some people are having to go home to their families, work-wise. Maybe that's the dynamics of the family. And it can become challenging when you're in confined spaces, if you don't want to expose yourself, if you're ever paranoid. How can people that are not trapped, but in close quarters, how can they manage this without
killing each other?
Exactly. I don't want.
Okay. My response to Michelle's very pertinent question is...
Because even the sanest minds can...
Yes, absolutely. So maybe use your intelligence there.
Right.
Now, this all depends on what you have cultivated and sown in relationships so far. Because it is not this particular corona that will determine how you will live. It is how you have lived before that will determine how you've lived.
Right.
So the thing is that if you had a good relationship, you have used intelligence, and the life is too short for having problems motto, that is too short, life is too short to have problems between human beings.
Yeah.
If this is your motto and you've lived your life and not everything becomes an issue of vanity and you do not have friction so much in general, then I think that's how relationships will be able to sustain themselves. And now is maybe the opportunity for people to learn, because the world is going to change after this. The capitalist system is going to change after this. The psychology of greed is going to change after this.
Do you think?
I think so.
Okay.
Because if it doesn't, then of course, there will be another virus which will probably wipe everybody out. Because which societies are more reassured? It's the societies which are welfare states, where state is actually able to provide people or give them the assurance that the state cares for them. In societies which are greed-based, total capital-based, there people do not have the assurance that the state will look after them. Why people have not gone for shotguns in England and in the United States, there are long queues outside weapon shops.
Oh.
That's the difference.
Right.
The difference is that people are piling up guns in US, but they're not piling up guns anywhere else in the world, because that is the heart of capitalism. Whereas Europe is not the heart of capitalism. It is the heart of a Euro socialist welfare state.
Yeah, I feel like it has a soul,
So
comparatively.
it does have a soul. And so the thing is that whatever is being done in England and in France and in Germany, Sweden, or elsewhere is not being done based on how much you can earn. It is being done by the health system because you are the citizen of that society or you are a resident of this society.
Well, that was the thing I wanted to point out in the question posed from our viewer in Canada, is that her hope is that everyone will come out friendlier and more grateful. Could that happen?
I think that it'll probably happen in two stages.
Right.
The first stage is that it may be that when people get together in the first instance, however they have interacted, they'll interact in that manner.
Right.
And they may feel claustrophobic and so on. But then gradually they'll realize that this is the way that they have to be. They can make themselves more friendly and support each other and nurture each other, or they can have frictions. And this is what happens. There is, I've just been talking with somebody, and there are a number of people living in a small 3-bedroom apartment, maybe 5-6 people, and they are now having to isolate themselves in that. And historically, they've not got on together, but they are having to now. Everybody was trying to avoid each other in the normal run of things. But now somehow Providence has brought them together. And now they were exactly looking at this in England. How will they survive? And my question was to them, rather than an answer, is that how do you want to survive out of it? You want to survive as a more nurtured, more united, more inter-reliant and more self-reliant set of people? Or do you want to come out more devastated and more traumatized?
Okay, wonderful. Thank you so much for your time. And in the next episode, we're going to be talking about the extreme isolation that some people are feeling and the effects it has on your mental health. Thank you so much, Dr. Makhdum.